Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Samah Khan. She's a pre-medical student. Today's Kevin MD article is The Crisis of Physician Shortages Globally. Samah, welcome to the show.
Thank you for having me.
All right, so tell us what led you to write this article and then talk about the article itself for those that didn't get a chance to read it.
Of course. So this article came from a moment of like really chilling clarity. So I was sitting in Modesto and my neighbor was talking about the fact that she had to drive 2 hours for a cardiologist. And I sort of had this flashback of my father's clinic in Pakistan, where patients would literally walk for days from villages in Afghanistan just to see him. And I like the landscapes couldn't be more different, right? One was arid and dry, and one was the agricultural heart of the global economy, but the symptoms were the same, right? The waiting and the profound physical distance between where sickness happens and where healthcare is allowed to exist. And I realized that we diagnose this all wrong. We call it a physician shortage in the valley and we call it brain drain in Pakistan. But those are just different presenting complaints. If two patients with different histories show up with the same disease, you have to look for the common root cause. And the root cause that I saw was a failure of value, right?
Mhm.
Both systems, one through neglect and the other through active pull, failed to value keeping a doctor in the community that needs them the most. In Pakistan, it's a system that trains brilliant clinicians and then gives them no viable future. And then in California, it's a system that trains them in the valley, but doesn't counter the gravitational pull of the coasts, right?
Yeah.
So writing it felt less like an opinion article and more like a case study. Here are two patients, patient A and patient B. Here are their vital signs, the wait times, the doctor per capita ratios. The diagnosis was structural abandonment, right? And neglect. The treatment is that you have to design systems that make the doctor's life and the patient's dignity the central value and the central focus, right? I didn't want it just to be a comparison. I wanted it to be a warning. If it can
Mhm.
happen in these two completely different places, it's not an anomaly. It's not a one-off phenomenon. It's a design feature of how we fail to build healthcare for the margins. And if we don't change that design, the deserts will only keep growing.
So you contrast that physician shortage where someone had to drive 2 hours to see a cardiologist in Modesto, California, to your father's practice in Pakistan.
Mhm.
I'm in New Hampshire. Tell me what Modesto, California is like. What's the nearest big city? Just tell us a picture of what that area is like and how easy or difficult it is to see a clinician there.
Of course. So Modesto is the world's largest producer of almonds, I believe. So like if you drive down any road, you will see almond trees lining every
Yeah.
like single square inch. And it is almost equally distant between San Francisco and Los Angeles. I think it's a little bit closer to San Francisco, but the Central Valley is really like what it sounds like. It's just right smack dab in the middle of California. I know Fresno is exactly 3 hours between LA and SF. So while there are some really good hospitals that are in Modesto, you have Sutter Health and you have Kaiser Permanente. A lot of specialized procedures, like you will have to drive up to San Francisco to go to UCSF or to go to
Mhm.
Stanford to get your treatment.
You mentioned in your father's practice, a lot of physicians who were trained in Pakistan eventually leave. And I think you gave some data in your article. One in
Mhm.
three Pakistani medical students plan to go overseas.
Mhm.
What are some of the reasons why they don't stay and practice in Pakistan?
Right. So Pakistan, like they will invest in medical schools, they will invest in education, but they're not investing in the salaries, in the job security, or in the healthcare infrastructure that could convince a graduate to stay, right? Obviously, every medical student wants the best salary, they want the best life to build a family, and that's something they're going to find abroad. That's not something they're going to find in their own country.
And are you seeing some similarities between that picture with what's going on in Modesto, California?
Yes, 100%. So my school, UC Merced, just started a pipeline program to get students from the Central Valley to an 8-year combined bachelor's in medical degree program with UCSF. So you're having these high school students getting a seat automatically in one of the top five medical schools in the country just to sort of convince them to stay in the Valley, work for the Valley, just like these homegrown physicians. And like there are steps to rectify that these doctor deserts that like I talked about, but the problem is still there, right? One program, which admits 12 students a year,
Mhm.
isn't going to drastically change the landscape of these doctor deserts. And while it is a good first step and it is like successful, this should be a model for future programs.
Have you talked to some of the medical students or clinicians in Modesto, California, in the Valley, and get some reasons about why they're leaving? Is it similar to what you said earlier? Do you just want to leave for the coast and big cities? What are some of the specific reasons? Because it doesn't sound like Modesto, California is that much of a rural area to me.
Yeah, 100%. So obviously there's better weather, better pay, more quality of life in the coastal areas. You have almost better prestige, honestly. If you say you're a doctor in LA or SF, that's gonna carry a little more gravitas than saying you're a doctor in Modesto or Fresno or Stockton. And also like these there are sort of a urban underserved area. I wouldn't say rural, but more urban underserved,
Hmm.
where like they need a lot more primary care physicians. They need a lot more nurse practitioners, sort of like first point of care clinicians than like super specialized.
In fact, in your article, you talk about 42% of family medicine graduates stayed in the Valley in 2024. So that really speaks to that lack of primary care. And I think that is endemic to the rest of the country as well in terms of finding that primary care clinician.
Mm-hmm. 100%.
So there's a certain irony, right? You wrote about these medical schools using public money to train these physicians, and then
Yes.
they leave that area.
Yeah.
So talk more about those programs. You mentioned a program in the past that hopefully would keep some of these physicians to stay in the Valley after they finish training.
Yeah, 100%. So, like, we can't just train more doctors, right? We've tried that. Like, Pakistan trains them and they leave. California trains them and they just cluster. We have to
Yeah.
be very specific. Like, what are the precise and tangible conditions that make a doctor stay? So, for the Valley's like prime programs, it was selecting students from the Valley, investing in them, tying their training to the community, to Fresno, to Modesto. It's showing them that this is your home and we will make it possible for you to thrive here. That's a design intervention and that's working, right? For Pakistan, it's a little harder. It's about rebuilding a system that's worth staying for. And that's a lot of brutal and a lot of long-term work. But the first step is just admitting that diagnosis. We don't have a doctor shortage, we have a retention crisis. And you don't solve a retention crisis just by recruiting more people. You solve it by fixing the place that people are leaving.
So you mentioned the Prime Track. You said that it is working. Do we have any data? Like, give us some stories or examples that show that it is really moving the needle.
Yeah, 100%. So that first cohort was actually admitted with me back in 2023. So they're still completing their pre-medical studies as undergraduates. But everyone that I had met was so passionate about medicine, about the valley, about like staying where they had grown up, building a practice even, not even just joining a hospital. And that just sort of speaks to the passion and the level of dedication that these students have to the valley. And of course, they're small, it's like 12, 15 people every year, but having that sort of like close-knit community is also very good.
So it's really interesting because whenever I hear about the doctor shortage, it's primarily in rural areas and you don't
Mm,
think of Modesto, California, but now you're seeing these doctor deserts, as you said, in these urban areas as well, I guess urban light areas as well, right?
yeah, 100%. Like it's about like the choice to reimburse a procedure in San Francisco at a rate that you'd never offer in Stockton.
Talking again about your father's practice in Pakistan. So what's it like there? Are medical students still leaving? So you talk about some structural changes. So is there any progress in Pakistan in terms of relieving some of these doctor deserts?
You know what? I wouldn't say that. I have family back in Pakistan. I have friends who are training as medical students, and they're all just so excited to take their USMLEs. They're so excited to
Yeah.
get out of the country. And like my dad saw it firsthand as well, right? He was Cleveland Clinic trained. He could have had a lucrative career here, but he chose Pakistan. And for years, he was that anchor in the community. But for every one of him, how many other brilliant physicians are looking at the crumbling system and the threats and the exhaustion and just getting on a plane, right?
Mm. So I understand that you are studying for a master's in public health. So I think that from a public policy standpoint, right?
Mm.
What are some of the policy solutions that can help with these doctor deserts? And like you said, it's not necessarily a doctor shortage, but it's more of a retention problems. Is there a policy solution that can help address this?
Yes, 100%. So I think Pakistan as a country spends less than 1% of its GDP on healthcare, right? And that, like, you can see that manifest physically. If we put a little more spending into something that is a basic human birthright, we will see results. Like, it will make more doctors stay. It will increase quality of life for patients. And I think the same goes for California. Obviously, it has the world's fourth largest economy. It could be a country on its own. But just spending a little more money in the right places, redistributing funds, like not even like pulling from anything else. I think like in my MPH classes, we are talking about like these countries making ethical agreements, like India making ethical agreements with countries abroad to give their physicians there, like because they have a surplus of really brilliant clinicians, and these abroad countries want them, but like as my professor said, it's kind of like having dogs that you're not feeding, and your neighbor comes and sees the dogs, and they're like, "Oh, you have a surplus of dogs, we'll take them." It's
Mhm.
not that you have a surplus of dogs, right? The problem is not the surplus, it's neglect. And the fact that you make a polite agreement with your neighbor to give them the dogs doesn't change the fact that you're not feeding them at home. So I think the real solution here is to start feeding your dogs at home.
So you mentioned more funding, more money. Of course, in healthcare, that's going to be a tough ask. So
Yeah.
again, let's say if you were in charge of public policy, what are some specific ways that we can reallocate those funds to help with that doctor desert in the Valley of California?
Yeah, 100%. So I would definitely put funding into these pipeline programs.
Hmm.
Obviously, a homegrown physician is the ideal a solution to this. I would invest in rural health clinics, community health workers, these sort of like anchors of the community that unfortunately don't recognition. There's a lot of other problems in the Central Valley. There's water insecurity. There's a large farm worker population. They have their own sort of slew of health issues and like corresponding health barriers. I mean, I conducted a sort of like secret shopper audit
Hmm.
of pharmacies in Fresno, and I found that 11 out of 95 listed pharmacies were closed, not open to the public, not like public-facing pharmacies, not and a large majority were not accepting new patients for controlled medications. So only one in three really said like, yes, we're accepting new patients. And that sort of showed me that it's not just a doctor desert, it's a pharmacy desert, it's really just
Hmm.
a healthcare desert. The next step after a patient sees a doctor is to go to the pharmacy and get their medication. And if they can't do that, then you label that as patients in Central Valley have low medication adherence or low compliance. But the fact is that they're just being turned away at every point in their journey.
So you studied in the Valley in California.
Yes.
So maybe give us a little pitch. What are some of the reasons why you think physicians should stay in the Valley? What are some of the perks and draws of practicing in the Valley?
100%. So it's sort of like that supply and demand, where there's a lot of demand and very low supply. So obviously there's like the prestige, the, recognition from the community, the gratitude, the instant validation that you
Hmm.
get from treating these patients who are starved with this resource. There are a lot of hospitals offering like insanely high packages, insanely high salaries to doctors who are willing to come just to sort of attract them and keep them there. So I think honestly, like if you look in the right places, you can find higher salaries in the valley than you can in the coast, just depending on which hospital you work at. The coastal areas are like suffering from overpopulation and overcrowding. They are going to eventually migrate towards the middle.
Hmm.
The real estate markets in Modesto and Fresno are booming because people are commuting a lot more to their jobs in San Francisco or in Los Angeles. So there is a lot of long-term potential for your job security, and like they need you. Yeah.
And sometimes it's just more than money because, as you said, these hospitals in Modesto are offering insanely high salaries, but people still aren't coming. So it has to be more than money that draws physicians to practice in the Valley.
Yes, 100%. It's just that really s- like stark hunger for physicians.
We're talking to Samah Khan. She's a pre-medical student. Today's Kevin MD article is The Crisis of Physician Shortages Globally. Samah, let's end with some take-home messages they want to leave with the Kevin MD audience.
Yes, so I actually want to leave this message just to look upstream, right? The patient in your office is often the endpoint of a broken system. You should advocate them by also advocating for audits, like of the algorithms, of the policies, of the insurance directories that failed them long before they reached you. That upstream ounce of prevention truly outweighs any downstream pound of cure.
Thank you so much for sharing your perspective and insight. Thanks again for coming on the show.
Thank you so much.